Yeah, it was a good experience though.
Lovely. Very, very nice. You'll be returning for that one, I bet.
Oh yeah, for sure.
Lovely, lovely. Yes.
Right.
Do we have any questions come in yet?
Not that I'm aware of. And you're totally across.
Hi everyone.
Oh, hi Philip.
Hi, how are you?
Hello.
I'm Pilar Sunday. I'm the media officer. I'm just in the background. I'm live streaming the Zoom onto our social media pages.
Okay, right. Nice to meet you. I'm Avril.
Nice to meet you, Avril. Nice to meet you, Professor Islam.
Yeah,
Nice
yeah, lovely. And thanks for your help. That's wonderful.
Not a problem. I'm going off the screen now. All the best.
Thanks.
Yeah. Hi, Pantelis.
Hey Pilar, how are you?
Good.
That's good.
People have started to join now, so I'll just mute you guys.
Hello all and welcome to today's webinar on parenting programs promoting better mental health in families with young children, presented by Professor Avril Brereton. Today's host will be Professor Bruce Tonge, who is a patron of the Mental Health Foundation Australia. Just to let everyone know, if you have any questions, please submit them in the Q&A section and they'll be answered by Professor Avril and Professor Bruce at the end of today's webinar. And also just to let everyone know, we're also live streaming this event to Facebook. So without further ado, please welcome Professor Bruce Tonge.
Well, greetings and welcome to all of you who've joined, not just around Australia and in Victoria, but internationally, and who are also picking us up on Facebook. I'd like to start by firstly acknowledging the traditional owners of the lands of Australia and the Torres Strait, and pay my respects to their elders, past, present, and emerging. Well, today is the third in a series of 3 webinars on what we know from research and good science are the fundamental building blocks of mental health and resilience in human beings. The first of these was presented by Professor Louise Newman, and she spoke about promoting attachment between mothers, families, and their infant. The second was from Dr. Kerry Bull, who talked about the absolute vital importance of 2 years of quality preschool. And today, we're in fact honoured and very pleased to welcome Associate Professor Avril Brereton, who's going to talk about the third of these building blocks, and that is parents as partners, education and skills training for parents. Now, who is Dr. Brereton? Well, she's a specialist consultant in child development. She's also been a senior research fellow at the Centre for Developmental Psychiatry and Psychology at Monash University and at Deakin University. And amongst many other things, she's been a regular consultant to the Victorian Department of Education and Early Childhood Services. She's internationally published research on mental health problems in children with developmental disorders such as autism and on parent education. So it's my great pleasure to welcome Avril, who's going to address us on education and skills training programs for parents. Welcome.
Thank you very much, Bruce, and hello to everyone who's joining us today for what I hope will be a very interesting hour. This is a topic which is close to my heart, certainly. I've spent a lot of time working with children and adolescents and their families, and it's of great importance that we look after everyone. And this notion of having education and skills training programs for parents where we're really promoting mental health and resilience in those families where there are young children is a real keystone, as Bruce said, to a lifelong basis for a good start in life. Let's put it that way. Could we have the next slide, please, Nithya? I want to put this talk into the context of this sort of circle of things. If we look at the middle of this, behavioural adjustment and well-being, this is what we're aiming for everyone. And while you're looking at this slide, you might think about how this works out for you in your experience of life and living. What's your behavioural adjustment and well-being dependent on? Because this is really the same for everyone. So if we look around this circle, if we look over to the right, let's start there. Social and family experience and attachment. This is really important. Back to the other slide, please. Thank you, Nithya. So we all know, other slide, please, Nithya, not that one. the previous slide. Thank you. Social and family experience and attachment are very important and will be different for everybody, but are so important. So you might think about yourself. How are you in this time and moment, and think back to what your social and family experience has been and the people who are important to you, because they will affect how you are living and feeling now. If we work backwards, educational opportunities and interventions for children and their family, these are important. Again, you might reflect on your own experience here. What sort of school were you at? What opportunities were available to you? And if you're a parent and joining us today, thinking about what have been the opportunities and the interventions available for your children, what are they currently experiencing? One of the things that impacts on the educational opportunities may well be this further box over to the left, the developmental level. Because if a child is born and they have some difficulties with their development, this may well then affect what their educational opportunities and the interventions available will be. So, for example, if a child is doing well, developing typically, they'll typically go to their local school. If a child has some learning difficulties, they may well be at their local school, but will require some extra support and help in that environment. Or there again are some children who the choice might be their family's choice and other people advising them that they need to be in a more special environment, educational environment. So educational opportunities and the interventions that are available for children and families will vary one from another. Biological and genetic factors come into play when we think about behavioural and adjustment and wellbeing overall. The family that you've come from, the history of that family, are there any things that run in that family that might affect you? We're going to be talking about autism in a little while, and we do know that in some families, in previous generations, there have been children with autism. There might be other biological factors, ill health, physical ill health. Might be coming into play, and they certainly have an effect on behavioural adjustment and well-being overall. Everyone's born with their own temperament. Some children are more resilient than others. Some babies, which Professor Louise Newman might have been talking about, are more difficult than others. We've all known babies who can be very placid and settled, and others not so. So temperament is something that we start off with and can definitely affect how well we get on with others and our general adjustment over time. And lastly, mental health or illness and other medical illnesses can certainly impact how well we're doing. So in the context of all of this, I want to spend some time talking about how we can help families by working together with parents in education and skills training, because there certainly is some evidence that this can help behavioural adjustment and well-being in the parents and also in the children. So next slide, please. Next slide, thank you. So how can we help? Well, let's go back to the beginning when a diagnosis is made. So today we are talking about children who have some developmental difficulties. So it's in that context. So a diagnosis is made and lots of questions then follow. What happens next? This is an area of work that I've been involved in for a number of decades, along with Professor Tonge. It's certainly our experience that the process of assessment and diagnosis can be a very difficult one, sometimes a very long drawn out one, and can be responded to in different ways, but there are always questions that arise after a diagnosis has been made. These are really important decisions that need to be made about the child's education and what possible treatment there is and so on. We do know that if treatment begins early, and it's really tailored really carefully to what the child's symptoms are and their strengths and the child's needs and also the family's needs. If it's tailor-made, then the outcome will be better. And there are a number of evidence-based early interventions that are more likely to promote development, to improve behaviour and reduce the stress experienced by the child and their family. And I want to talk about some of these. Next slide, please. So first up, and we are talking about little children today, young children, early educational experiences, early intervention programs are quite widely available now. They're highly structured. They involve parents and professionals working together. And I think one of the really key elements about good early intervention, educational early interventions, are that they are based on an understanding of the child and the difficulties that they're facing. So each program needs to be an individual one that is also family-centred, because there's no point in having a brilliant early intervention plan if it's one that doesn't suit the family as well. Because if you've come up with a whole lot of ideas about what would be good for this child, but it doesn't fit with what the family needs or is capable of following through with, then it won't be as successful. So a good early intervention program will be highly structured, but it will always be one where there is development of a plan that is family-centred and suits everybody's needs. So these programs can be centre-based or they can be home-based, and probably the best of them are a little of both, so working across different settings. Next slide, please. There are some other types of interventions that you've no doubt heard of. There are behaviour-based interventions, and these are behavioural interventions that are really focusing on teaching new skills. How do we teach children who might have developmental delay or other difficulties new things? Well, it can be trickier than for children who are developing more typically. So teaching new skills is an important part of this, and definitely coming at managing difficult behaviour from a position of supporting positive behaviour. I think this is one of the things that I've seen a huge change in my time working with children and families, where we used to talk about behaviour management and challenging behaviour and so on, but there's a different slant on this now, where we're talking about actually providing a positive behaviour support. So as we teach new skills, we're also supporting behaviour in a very positive way. It's not negative, it's not punitive, and it's encouraging children. So that's an important type of intervention as well. And another approach to working with very little children is one that's therapy-based. So in an early intervention program, there will typically be a combination of different sorts of therapists, occupational therapists, speech pathologists and physiotherapists, for example, and they'll be targeting very specific developmental areas. So for one child, they might have more needs and need to spend time with a physiotherapist and occupational therapist around improving motor skills and daily living skills. For other children who have some developmental difficulties, they might have more need in the area of communication. So perhaps for them, their early intervention program will have more time spent with speech pathologists and developing communication skills. These little photographs are examples of a friend of mine who is a special educator who's teaching children in a centre-based setting about how to play, because some children with developmental difficulties need to be taught how to play, and it's an important part of their early intervention program. And in this case, the children are being taught to look at some photographs to give them some ideas about how to play in a dolly's corner. Next slide, please. So this other area, which I think is a very important one when we're thinking about a broad-based intervention for young children, is family-based interventions. And there is absolutely no doubt from certainly my experience in working with children and families that most families are wanting help and support, and they ask for it. There can be all sorts of things that are stresses for the family and for the child, no matter what the severity of the child's symptoms are. So, for example, with a parenting program where we're working with children who have an autism spectrum disorder, we spend time in this sort of parent program with groups of parents coming together. As you can see in the photograph here, this is a photo of one of our sessions, fathers and mothers and other carers as well. And we're teaching them how to promote things like social interaction with those children, how to promote very positive behaviour, how to be working on and teaching daily living skills and communication skills and so on, because they're really hallmarks of the difficulties that many children with autism have around learning social interaction and social communication skills and improving a range of behaviour and general skill building for them. We do know that there are some evidence-based programs that can really help improve child outcomes and also do things like reduce family stress. And I want to talk about two of these today, but there are many. And I'm talking about these particularly because they have the sort of core ingredients that, if you like, that we know are helpful. So the Stepping Stones Triple P, the Positive Parenting Program, is one, and the Preschoolers with Autism program. So next slide, please. We'll skip that video, thank you, and go on to the next slide. So the Australian Stepping Stones Triple P project is a very interesting one. It's very broad. It's been developed by University of Queensland, Monash University and the University of Sydney in a large collaborative study. And this is a public health approach to supporting parents and caregivers of children who have a disability. It's been funded by the National Health and Medical Research Council of Australia. And it's had some very specific aims, and it's been looking at, can we develop a parent program or an education and skills training program for parents that really helps to reduce behavioural and emotional problems in the children, certainly support very positive family environments, and I think really very importantly improve family well-being, how well these families are managing, and empowering parents as well to be making decisions and deal effectively with any difficulties or behavioural issues that the child might be presenting with. Next slide, please. So I said this is broad. This has had about 3,000 families participating, and there have been some very positive and strong results from this program. So it's been developed for children who are aged between 2 and 10 years. It is available. A lot of people trained in its presentation, and there is an online version of it available as well. In Queensland, Victoria and New South Wales, the first trials were undertaken. So what did they find by having a program that's specifically targeting parents who have children with an intellectual disability or a developmental disability, and coming into their programs, they found that, for example, child behaviour and emotional problems had decreased. So they were measuring these with a number of different measures before the intervention, after it. And then they were checking in 12 months later as well, just to see that if there were gains made, that they lasted over time. They found that parental depression, parental anxiety and stress had decreased over that time. And interestingly, parenting skills, teaching parents how to positively encourage their children had really improved across the time of the intervention, and even 12 months later was looking good. Look, a very interesting aspect of this research too was that they found that the intervention was of what's called cost benefit to the families. So for example, when families began the project, the program, they may have been missing from work for considerable amounts of time because they needed to be at home and looking after the kids for one reason or another. But after the intervention, more parents were back at work and weren't losing income from being away from their employment. Next slide, please. This is just showing you in graph form, and don't want to spend a lot of time on this, but just what's important here, looking at two slides. So overall, difficulties and behaviour problems that children were having, these decreased over time. So the first decrease you can see was the time across the intervention, and then 12-month follow-up. So the changes that had been made, so a decrease in behavioural difficulties that the children were having was maintained a year later. So that was a good outcome. And the next slide. This is just one of many outcomes that were measured, but this is the slide about parental depression, and an important finding here that parental depression decreased across the intervention period, and that improvement was maintained 12 months later. So this is really making a difference to parents, even a year after the program has finished. Thank you. Next slide. So some key take-home messages from the Stepping Stones Triple P program. Certainly the first one is that this program can be successfully implemented in the community with a community-based range of practitioners, a broad range of disciplines. All sorts of people learned how to deliver this program. There were improvements in child behaviour and emotional problems in the children. Very importantly, improvements for parents around such things as depression, their anxiety and feeling stressed, and definite improvements in how they were managing their parenting. Next slide, please. I want to spend some time talking about what obviously you can see from the cover is a program that Professor Tonge and I developed about 10 years ago. And this was in response to, I think, our clinical experience of working with children and families for many years. And we found when we were looking at a very large group of children over a period of many years, that some were doing better than others. And when we look back at it, the children who seemed to be doing better and their families were those who'd had some parent, some opportunities for attending some parent education sessions. So we thought, right, well, we better find out the evidence for this, see whether if we have a very structured program and we have what's called a randomised control trial, tightly managed, whether we can say, yes, there is definitely evidence that this makes a difference. So that's how the Preschoolers with Autism program began. It was funded by National Health and Medical Research Council of Australia. It's a 20-week program. There are 10 group sessions and there are 10 individual sessions. And we had overall probably about 100 families involved in this initially. Let's see the next slide, please. It is a manual-based program and the manual's still available. Why would parents do this course? Well, first up, and what was held to be important by parents themselves was that they were going to meet other parents whose children had autism, and they wanted to share their feelings about that experience and have an opportunity to talk things through. They wanted to learn more about autism. They wanted to learn how autism affects their child's daily life, how they were communicating, what was happening with their play and their behaviour. And they also wanted to know, how can they help? How can they help their children to communicate better? And they wanted to learn some skills themselves around how do we teach our children to play? How do we teach our children to be more social? And certainly they wanted to know about managing difficult behaviour. There's a little video here that I want to show you. So you can see this is just a room with me, my back to the camera, and we've got 3 mothers here. Importantly, in this program, and since it's been running out too, we've had parents from all sorts of cultural backgrounds in this. One of the parents was Vietnamese and certainly had enough English to be a participant in our session. We didn't have a translator in this session. In some other of our sessions and groups of parents, we did have translators working with us. We would typically have it's just an ordinary sort of playroom. There's a blackboard and we would be discussing things. In this one, we're talking about some ways of managing behaviour. We'll just listen to this for a little while. Please, Nithya, can you turn on the video? Do we have some sound?
What are some of the ways that you're stopping them doing things? Stopping them from doing them wrong. How are you stopping the kids doing things at the moment? So we've talked about a few of those, haven't we? What are some of the ways that you're stopping them doing things? Stopping them from doing the wrong thing? You ignore, like that chips, you ignore when he's being stubborn and not cooperating.
I do find times when I get a bit angry, I raise my voice. I don't have to yell at him, but just raising my voice. So
You don't shout?
I shout. It'll just be, Harrison, stop it now.
Okay, so you might. Oh, you're lucky.
Yeah, I know. I don't have to go, look at me. That's what you got.
Okay, thanks, Nithya. We'll stop that there. Thank you. So look, you can get something of a feel for this program. You can hear people having a bit of a laugh, and it's we try and keep things relaxed, straightforward, and these Blackboard tasks were a really great way of getting some ideas down. So around this session about behaviour, we were starting from things like, well, what are some of the things that your kids are having trouble with? And we'd write them down. How are you dealing with it at the moment? Is it working? And so on. So next slide, please. I want to show you just how the 10 sessions pan out. So 10 group sessions, and we would have a maximum of 5 families at these, which we always tried to have both parents there when that was possible. Sometimes we had grandparents attending as well, or other people who were involved in the child's care. So this is a construct that I think is suitable for all sorts of different kids. So this one happens to be about autism, but it could just as well be about children who perhaps have cystic fibrosis or any other issue, ADHD. But the hallmarks, I think, are around having the following elements. So in session 1, because this was about autism and ASD, we spent the first group session and then individual session talking about what autism is. How is it assessed? How is it diagnosed? all of the families who were in this program, their children had been assessed and they did have a diagnosis of autism. But for some parents, that hadn't been easy and they needed an opportunity to talk about it. And I think this is one of the really valuable things about a program like this. It's not just about skill building, it's not just about education, it's about an opportunity to talk, to have a discussion, and to have a discussion in a safe place with parents who've experienced similar things. So we talked about assessment and diagnosis, the process. In the individual session that followed that, parents would bring in their assessment reports. We'd have an opportunity to go through them, talk about what was there, what did it mean. And for some families, yes, they'd have an assessment report, but they didn't really understand what it meant. So I think this was a really very valuable way to start this program. And the second session was about other issues. What were you worried about? How are you feeling now? What's your response to the diagnosis been? And that can take you anywhere in a group discussion, and then importantly follow it up with an individual session, because sometimes parents don't want to talk in a group session with other people around. They like to be part of that group dynamic, but they also want an opportunity to be talking with the clinician themselves in a more private way. Because we're talking about ASD here, or autism, it was important to talk about how do we manage behaviour? How do you start? Where do you start? How do you start choosing and setting goals? And this was a really interesting part of the program, because we needed to talk about things like, well, do you need to change behaviour? How much of a problem is it? Can we prioritise things? Sometimes parents of very little children who'd just been diagnosed were feeling overwhelmed. There seemed to be so much that needed to be done, and where do you start? So we then spent so this is really 6 weeks of the program, looking at group and then individual sessions about how you might change existing behaviour, how you might teach new skills that might replace some of the behaviour that is problematic for the child. Because again, this is an autism program. One of the hallmarks of autism is that children can be having difficulty with communicating. So again, because this is for children who are about 2 years of age right through to about 5, there were children who were verbal and others who were non-verbal. So we needed to have covered both of those scenarios in this. We then moved on to talking about some social problems, how to improve social skills, and getting parents to choose which social skills they wanted to be working on. And then session 9 about working and playing together, developing play skills. You can see some little pictures here, the one on the bottom where a mother was learning to use a little picture card to get a child to decide what they wanted to play with and let her know. And there's a little video on the top. Could we see this please, Nithya?
Oh, I want an apple.
And she's clearly very pleased with herself. So just an example of really how a program for parents can follow up and build on therapy that will be happening with the child. Perhaps it's centre-based or with the speech pathologist in those sessions, but it's taking it home, showing parents how to put those things in place in the naturalistic setting. And this is an important one for children with autism and for kids who have other developmental difficulties, is that we do know that they learn best in natural settings. So what's learnt in a specific therapy setting needs to travel across to home in a consistent way for lots of daily practice. Thank you, Nithya. Next slide. So there are just some graphs here just to show that we can be sure that this was helping parents and families. The blue line is the one I want you to concentrate on most. This is the parent education and a behaviour management component to it. The red line was where we had parents coming in and there was more counselling without specific skill building when we were trying to work out what works best. So the combination of some education and skill building for parents was definitely the best one. So you can see first up pre-treatment, 6 months, post-treatment, because the program lasted about 6 months, and then we followed for 1 and 2 years to make sure that any gains were actually maintained. So this is an important slide for us and for the families who were involved in the program, that parental mental health was greatly improved by a decrease in mental health difficulties over the course of the program. And then 1 and 2 years later, it was still looking good. In fact, it was improving further. The green line is the control group. These were families who didn't have the program. Their children were involved in whatever was locally available to them, but agreed to be part of our program. So there was not much change for families who were in control groups, but those who were in the active treatment, definitely there were great improvements with parental mental health. Next slide, please. And this is parental stress. What I think is interesting here is certainly in the treatment groups, in the blue and the red lines, we can see that stress definitely went down for parents. What I think is interesting is the green group, where the parents weren't in the program, that after diagnosis and 6 months later, their stress actually got worse before it started coming down. And I think that this just shows us that from diagnosis on, and particularly for that first 6 months or so after diagnosis, this is a really difficult time for families. And it's one of the reasons why in our program we really wanted to target getting in quickly and working with families as early on as possible from the time of diagnosis, when parents were looking for information and needing help as to what the next step would be. Next slide, please. We were rating what was happening with the children in a number of ways, and one of the measures that we used, because it was pertinent at the time, was to use the Childhood Autism Rating Scale, and looking at their autism symptoms. And again, the blue and the red lines, the active treatment groups, there was a decrease in autism symptoms during the program itself, and even 2 years later they were still continuing to decrease. So that was a good outcome for children as well. We're not saying that it made the autism go away, because treatment doesn't do that. Autism, we say children grow up with their autism, they don't grow out of it. So we were very pleased to see that their symptoms were decreasing over time. Thanks. Next slide. I also want to talk a little about the wider family. And this is work that I've been doing more recently, and that is with grandparents. We certainly are aware that more grandparents are looking after children while both parents are working, and are wanting to be involved in care of grandchildren. But there's absolutely no doubt that being the grandparent of a child who has some developmental difficulties does present challenges. And I guess for grandparents, it can be difficult in different ways. So if you're a grandparent, you're the parent of a child who is the parent of a child with autism or whatever the other developmental difficulty is. So for grandparents, there can be a sort of double load of sadness and worry. You worry about your children and you worry about your grandchildren as well. So with the work that I've been doing with grandparents, again, it's been around ASD, and running these groups is fascinating, and I find very, very interesting and enjoyable as we bring grandparents together. And they are often quite confused about what ASD is. They can be confused because as grandparents, they've seen it, they've done it before, and they can be really struggling with why their tried and true methods of raising children don't seem to be working with their grandchildren who have ASD. So they can be really quite confused by situations like this that you can see in the photograph of a little child who, rather than having all of the lovely toys to play with at Grandma and Grandpa's, chooses to go to the cupboard and stack tins. What do they do about this? They haven't seen this before, or children who are particularly fussy eaters or having sleeping difficulties or really don't like change. So next slide, please. We are recognising that grandparents want help too. So when we're talking about education and skills training programs for parents, there's a definite need for grandparents as well to be considered. They want accurate and up-to-date information. They want a program that helps them to define their role as a grandparent too. Often grandparents that I've been working will say, I don't want to stand on anyone's toes. I don't want people in the wider family to think that I'm interfering or something, but I really want my time with my grandson or my granddaughter to be an important one, and one where I feel that I'm helping. So they need information just as parents do about, so in this case, what I'm doing at the moment about autism. They want to understand what sort of behaviour support programs are in place, what communication strategies are happening. So thinking back to that video of the little girl who goes to the fridge and chooses a photo to show mummy that she wants an apple to eat because she can't use the words, the grandparents want to know how they get that program to work for them too. Concrete skill building they want. We are certainly developing more and more ideas about how to go about including grandparents, and we are finding that this sort of education and skills training that's tailor-made for grandparents is really helping. Initially, we were having perhaps just 4 sessions, but we found that grandparents would say, please, can we have another one? We'd like to talk to you again about whatever it was. So we're definitely responding to a need that had arisen. Now, last slide, please, Nithya. I guess one of the really important messages that I wanted to get across today, that early intervention means early in life. So the program programs I've been talking about are starting for children who are about 2 years of age. So this really is early in life. And there is no doubt now that from good research that's been done and the experience of people over the past particularly 2 decades or so, we can say that education and skills training programs for parents or carers of young children who are newly diagnosed with a whole range of developmental difficulties. I have been talking about autism, but I think these parent skills training programs are important for parents who have children with all sorts of difficulties. It might be developmental delay, it might be attention deficit hyperactivity disorder, and so on. But we do know that if parents can come into a program which helps educate them about the child's difficulties and gives them skills, that these are really important to be helping parents themselves with their mental health and adjustment, and that we're also seeing improvements in the children's behaviour and also the children's mental health and adjustment as well. And this isn't just something that is something that's obvious at the end of the program, but we know that 1 and 2 years later, the improvements are maintained. So I think in a perfect world, opportunities for parents and grandparents to come and learn more about the difficulties the child might be having and what to do about it in a positive way. In an ideal world, that is available as a part of early intervention programs. And so families are seen as partners in the intervention program from the beginning. And from the beginning, I mean early and as close to the time of diagnosis as possible. So thank you, and I look forward to some questions from Professor Tonge.
Yes, indeed. Thank you, Avril. That was very illuminating. And there have been quite a number of questions, which some of them I've put together. Firstly, I want to make it clear, a number of people have asked, will this program be available to look at later? Because, for example, a couple of people that they were working with other families who can't watch today because they've got children at home, they're educating, and they'd like to look at it in the evening. And as far as I understand, yes, the webinar will be available through the Mental Health Foundation website. Now, the first question, and I suppose it links to your last comment about wanting to have a universally available parent program for families of children with various developmental difficulties, comes from a parent of two daughters with autism who asks whether or not family support activities or programs like this are funded by the NDIS. Now, what's your comment on that? Can you get, through the NDIS, a parenting program if you've got a child with an accepted disability?
Yes, you can, Bruce, but it depends, or it's reliant upon the discussion that you have with the service provider or the case manager that you have through NDIS. You need to request that part of the child's program is parents attending an education and skills training program. And as far as I know, it also depends on service managers, NDIS managers, getting together groups of families who might be looking for the same thing to get a group coordinated, but not necessarily that. The other thing is that we're talking about group programs, but it's also possible to follow a program such as the Preschoolers with Autism with an individual clinician through your NDIS service provider.
In other words, it really is up to the individual to say,
I've
heard about a parenting program and we want one for our child, because otherwise, who would know about it?
Yes, that's right. I think that I would draw to your attention that certainly across Victoria, in the past we've trained over 100 clinicians to develop to present this group program, and a number of the service providers were doing that, particularly through the Helping Children with Autism program. But at our clinic in Woodend, one of our staff members, as soon as there are a group of parents who are interested, they are accessing this program. So it is doable, but parents need to ask.
And as well as that, there's not just the Preschoolers with Autism program, but there's the Stepping Stones Triple P and other programs that are available.
Right.
So I really encourage that parent to make inquiries and to get their fund manager to advocate for that being part of the package. Yeah, that makes sense. Now, the next question, it's a very interesting one. The person that's written in here says that autism is very hard to diagnose in girls. And to some extent, I agree with that, although it's not always the case now. I think in the past it may have been so, but clinicians are becoming much more skilled at recognising autism in both boys and little girls as well. However, leaving that to one side, this particular case, the young woman was not diagnosed with autism until she was 19. And this parent says if only she'd have had a parent program when this girl was little. And the girl at that time suffered from very severe anxiety. In other words, she's asking, might a parent program be available for a child with severe anxiety? because, of course, at that stage, autism wasn't identified.
Mm. Bruce, I think one of the messages that I really want to get across today is that parenting programs need to be available for a whole range of difficulties that a child and family might be having. So in terms of anxiety, now there are parenting with feelings program is helpful, isn't it, for children, or tuning into kids. These are parenting education skills training programs which are helpful for children with anxiety. And this is an interesting one too. So we did this work developing the program for very little children that we called preschoolers with autism, but we also developed another one at a time when parents were asking for help, and that was when their children were approaching adolescence, and we called it Growing Up with Autism. And an important part of the program for children that age was looking at their emotions as well, anxiety and depression, because we do know clinically, don't we, Bruce, that during adolescence, this can be a time when children can be more prone to getting anxious and sad and worried. So yes, there are other programs available and for children with anxiety. And again, I think it's a case if a child is receiving or young adult is receiving NDIS support, you would hope that the service manager is aware of a range of things that are available wherever it is that the young person is living.
Yes, that's certainly true. There are a number of programs out there to help children who are anxious. There's Triple P, for example. That's a parent program that deals more broadly with children with various difficulties like anxiety or difficult behavior. And there are some anxiety management programs for children in which parents participate, even some of them online, like from University of Queensland. Sue Spence runs one there, and that's, you can Google that or go to your website directory and find those programs. There was a subsidiary question about whether we have a list of service providers. Now, in fact, Australia and Torres Strait Island is a big place, and no, we don't have a complete list. But I suggest, for example, that you could look up the Triple P website that has service providers around the country. But most importantly, if you ask your early childhood services about local parenting or parent programs, they're probably the people that would know. Now, I've got another question here, which I think's really quite a pertinent one, given the work of the Mental Health Foundation Australia, is how can culturally sensitive programs for parents be provided for culturally and linguistically diverse families and communities? Now, you touched on that when you were talking about the membership of your group with one person being Vietnamese, but what about to a Vietnamese community or a community from Sierra Leone or something like that?
Yeah. Well, I'm glad you've asked this question. One of the delightful things that happened after we'd had the Preschoolers with Autism program running for a while, a colleague of mine, Chinese and Cantonese speaking, was a speech pathologist, was very keen because she was working in Chinese community in a suburb of Melbourne to be doing this program in Cantonese. So it was lovely to be invited in by the Chinese community, who helped translate the program. We back translated it to make sure that it was correct. And then Helen was able to successfully run this program in Cantonese with Chinese families. It's doable. What's wonderful is when the approach is made. I don't think that we want to wade in, say, this community needs this and here it is. That's not the way to do it. You have to collaborate, so you need to be invited in, particularly when thinking about Aboriginal and Torres Strait Islander communities. If there is an invitation in to help, then you can tailor make the program to suit that community or that cultural group. I must say that running out our research program for Monash, it's a very diverse area. So in our program, we had parents from all sorts of different cultural groups. And what was interesting is that we didn't strike any difficulties with our program in terms of it not being sensitive. And I think that's because in a group program where parents are encouraged to ask questions and be involved and then have individual sessions, there's room for movement. There's room to adjust things so that they are culturally sensitive in that community. It's doable.
Yes, and in other words, the basics matter, don't they, regardless
They
of...
do. I mean, I must say, Bruce, I left out too that we even did this training in Vietnam. We did it in both Hanoi and in Ho Chi Minh City. And we trained clinicians in the basics. And in fact, it was embraced so well that when children came into major children's hospitals for assessment and diagnosis, if a diagnosis of autism was made, the parents stayed on at the hospital for some weeks to do the program before they went out again, some into fairly remote areas. So that was embraced wholeheartedly and worked well and still works well.
Now, here's a very tricky question. I mean, this is probably years of research required behind this question, but the person asks, what do the children with autism think their parents are doing? In other words, is that about, how do children with autism...
This is a lovely, I think this is a lovely question. A lovely question, because when we run our programs, we typically have children there for the individual sessions, so they sort of know what's going on there. And if we're working on skill building, that the clinician might demonstrate a certain technique or whatever it is, and then the child is involved in that. So they've got a pretty good idea of what's going on. But also too, we would have babysitting available. So when parents came along to the group, the children were there and in another room. So my sense of that, and from what parents have told me, is that children were feeling encouraged. They mightn't know why, but they had a sense that things were getting better. They were doing better, particularly with our skill building tasks. We work on things like chaining, breaking things down into little steps, so the children weren't failing all the time, but parents were learning, I can teach them this bit and that bit and that bit. So you were building on strength. So it had a really positive air to it. Children pick up on that.
Yes, in other words, the children with autism have minds, don't they? They have think, thought, and they're desperate to communicate. And your program, in fact, helps parents to come up with ways of communicating with them, like that lovely little video clip of that girl letting her mother know she wanted an apple, even though she didn't have the language to use it. Now, we've just got time for one more. It's a lovely question, actually. Is there anything wrong with just reading books about being a parent or asking your own mother for help? A good question.
Nothing wrong with that at all. And it is a good question. And this is important. I suppose one of the things that's making a difference these days is that we tend to be living in nuclear families. We're not living in an extended family situation as might have happened some time ago. So the availability of advice from parents, from mothers, mightn't be as readily sought as it once was. But yes, when you have people who love you, who are interested in you and how you're getting on with your children and so on, they may be your mother, might be somebody else. You go to them and you ask for advice. And sometimes it will be helpful, sometimes it mightn't be. So with the grandparents that I'm working with, sometimes I'll say, I don't know, I'm not sure what we should be doing. How can we find out? And yes, books are good. I mean, one of the things about our book is it takes you step by step through this program. There are questions, there are little homework tasks to do. So that's doable on its own. And it is with a number of other programs as well.
The other thing about most of these programs now is many of them are online, and that's opened the doorways. It's one of the benefits, if you like, of COVID, that a number of resources are now available online. We've run out of time. I think if there are any remaining questions, we will have a record of that, and we'll try and perhaps put responses into our newsletter. Thank you to all of you for joining us. We hope you found this of use, and I'd like in particular to thank Avril for the presentation and sharing your experience and expertise and compassion and empathy with us about these children and their families who really have big hurdles to manage. So thank you, everybody, and we'll all say goodbye and stay well.
Bye. Goodbye.